Nick Hartshorne-Evans, it's the World Heart Day today. You represent the Pumping Marvellous Foundation. Do you feel the conference is going well? Do you have good hopes for the future?
I have a lot of hope for the future. I have heart failure myself, so that's what I grasp onto. But there's been excellent representation from MEPs, health economists, cardiologists, and a lot of patient representation there as well, which is important because it represents the patient's voice. Because at the end of the day, we haven't got to forget that the patients are, this is what we're doing it for, making sure that the quality of life of heart failure patients are well represented in the top table conversations.
And tell me, what exactly is the difference between a heart attack and heart failure? Because I imagine a lot of people don't know.
Well, a heart attack is an event that happens, and basically it's the coronary arteries get furred, and it's a one-off event, but it can lead to scarring of the heart muscle, because the heart is one big muscle, and in 6 months plus, potentially if the heart's scarred, it could lead to heart failure. So if the conversation around heart failure isn't evolving, then people are thinking they're going to be dying of a heart attack, where actually they may be dying of heart failure.
Do more people die from heart failure, as you've just defined it then, than a straightforward heart attack?
I don't know what the exact figures are, but I know in the EU there are 15 million people living with heart failure, and also the prognosis for heart failure is worse than most forms of common cancers apart from lung cancer. So if you look at the statistics based on that and the profile of the conditions, then absolutely, heart failure has to play a major part and major stay in health policy across Europe.
It's such a major killer then, and obviously events like today can only help. What hopes do you have for the future?
Hope is everything. Hope is a word that patients can latch onto. So I am hopeful, or more hopeful than I was 5 years ago, because 5 years ago the drug treatments were so old. They've been around for years and years and years, and they were standard treatments. But now there are a lot more innovative treatments coming through, and also devices which are cardiac pacemakers and cardiac resynchronization therapy. So absolutely have hope for the future, but I also have hope that people are going to see the problem isn't just about clinical therapy. It is also about how to engage with the patient and get the patient to understand what they need to do to manage their care.
So there needs to be more information so that we can have a better management of this condition.
Et le futur, Pierre, qu'est-ce que vous croyez? Est-ce qu'il y a une bonne chance de vraiment améliorer la situation à Europe avec ce que vous avez fait aujourd'hui et ce que vous allez faire en futur?
Donc voilà, on a de l'espoir. Aujourd'hui, on appelle à agir. On remet aux décideurs une boîte à outils avec une série d'initiatives, d'exemples, de données factuelles concernant l'insuffisance cardiaque pour que l'insuffisance cardiaque devienne une priorité de santé publique au niveau européen et que des mesures qui sont recommandées par les sociétés savantes, comme la Société européenne de cardiologie, soient prises en compte et que le financement de ces approches pluridisciplinaires du travail des infirmières spécialisées dans l'insuffisance cardiaque deviennent une priorité pour la prise en charge de cette pathologie chronique.
In the future, there is hope. You've heard that we've launched a call for action. The call for action involves also the toolkit. In the toolkit, of course, we give all the information, all the data which is necessary for people to be better informed. But what we want first and foremost is that the heart failure becomes a priority for all healthcare professionals and healthcare systems throughout Europe in all of our countries. The European Society of Cardiologists and all the healthcare professionals need to be better equipped, better informed, more aware of the disease.
Deborah, hello, welcome to the conference. It's World Heart Day today. Now, I understand that you've been suffering heart failure yourself for some 2 years. How is it, for want of a better question?
Difficult, extremely difficult, but you do learn to live with it.
When you say you learn to live with it, was it a shock when you were first diagnosed? Was it something that you felt was coming on, or did it come upon you all of a sudden?
The initial shock is the hardest to live with, and that can really take some time to work. It took me just a little under 2 years to accept what was wrong with me. But now I've built a new life, and I've built my new life around living with heart failure. So you can live positively with it.
And when you were first diagnosed, what was the prognosis like for you? Was the prognosis gloomy, or did the doctors say, no, we can do an awful lot for you?
Now, at first it was extremely gloomy because you hear the word heart failure and then they give you booklets and in there it says all the time, most people die within 5-6 years. So yeah, obviously that is really frightening. But with new medical advances and new medicine and
As I say, it's World Heart Day today. Events such as this are obviously doing a great deal of good. I expect you'd like to see more and more information about heart failure coming into EU policy.
Definitely. It needs to change. We need to get it out there. We need to do this. Yeah.
Deborah, may I wish you all the very best for the future.
Thank you very much.
Ian Duncan, Conservative MEP for Scotland. Today is World Heart Day. Is it a good day to be a Conservative and have a heart?
Every day is a good day to be a Conservative, and we always have a heart. And that's why I'm proud again to be working with heart failure, an issue that affects so many lives in Scotland, in the UK, and right across the EU.
They were speaking today about the fact that so many people, it seems, despite how many people suffer from heart failure, many people don't know the difference between heart failure and heart attack. Is that something that you think will improve with EU policy?
Well, I think this toolkit will help us make a start on that. I think those people who ultimately suffer know the difference, but the problem is quite early on diagnosis is not made correctly, and that causes significant problems to those who suffer from heart failure. We know what a heart attack is because someone falls over. Heart failure is a much slower progress, and if that can be caught earlier, lives can be saved.
How is it caught earlier then? I mean, what is it that would sort of say to a doctor, James, you have, I think, heart failure? What are the symptoms?
Well, I think in reality, once you get to the doctor's stage, I would hope the doctor can actually catch what's going on. The real test is when you start seeing the problems yourself. So the shortness of breath, some of the symptoms which you'll actually be able to recognise, which are just changes in your own body. If you can begin to recognise what they are and you understand what they are, and the toolkit can help here, then you consult the doctor. And at that point, you should be in safer hands. The problem is that more often than not, people wait until the symptoms have crossed a line, when there is a body crisis at some point. And by that stage, it's much, much harder to address the fundamental issue that can actually save lives in the long term.
Strikes me, therefore, that it's a much more long-term prognosis. Are there, therefore, increasing chances of heart failure sufferers to survive and go on to live long, healthy lives, do you think?
I would certainly hope so. The point is, again, it can't just be pre-awareness. You've also got to follow through, so right through the clinical stage and thereafter, because in fact it's a lifetime that you must be able to deal with this situation, and that's part of the challenge for those who have heart failure as a constant companion. But the point is, they can still have a full life. Once they understand what is going on, they can address these challenges and they can actually embrace them and move forward to a productive and healthier life.
Do you believe, therefore, with events such as today and with things like World Heart Day, that the EU and therefore the world may be moving in the right direction? Do you have good hopes?
I have high hopes, and I know that the people who have come here today are doing exactly the right thing. They are letting us understand what the situation is. They are promoting a clear agenda for how to help people, and they're telling people what to do. And I can think of nothing more sensible when confronted with a challenge like heart failure than what the people here have done in this seminar, and they continue to do and will continue to do going forward.
Edward Harding, you represent the Secretariat of the European Heart Failure Policy Network. Today is obviously a very big day. It's World Heart Day. How well do you think the conference has gone thus far?
We're absolutely delighted. This is the first time that the network has really launched something absolutely major. We started working with our members about 12 months ago. We are very privileged, I think, to have the trust and support of a range of clinicians, patients, parliamentarians, and I think today was about the group coming together, launching our call to action, and really for the first time ever having a cross-sectoral consensus on what the issue is, how we go forward, and really our next step. So today for us is a very big event.
Strikes me it's about communication as well, Edward, because an awful lot of people don't actually understand the difference between heart failure and a heart attack. How well do you feel that EU policy is moving towards getting that message across?
I think it's a very tricky issue. I mean, clearly public awareness is low and professional awareness is low, also of heart failure. And this can be for many reasons. I mean, heart failure simply has not featured in many national strategies until now. It's simply not something that is widely discussed or talked about in public life. It's a very complex issue. What we do know is that the disease is very prevalent. 1 in 5 of us are at risk of developing it in our lifetimes, and it carries a very significant economic and social burden. It's up there with the other big chronic conditions. So the way forward is very clear. We need to get talking about heart failure. We have all the messages in one place. That's what the toolkit has done. And the network, we can all take confidence from the fact that patients, clinicians and parliamentarians have come together. We have a clear vision, I think, for the first time that's shared across disciplines, a clear vision for how we drive this forward in public life. And we absolutely need to raise awareness going forward. But to do that, we need the support of our members and we need the support of other people. So I'd like to invite anyone who wishes this project well, who would like to help raise awareness, to look at the toolkit, to sign the toolkit, to sign the call to action, and to help spread the word.
Just one last question. Is heart failure something, therefore, that you can be cured of?
Heart failure is a chronic condition. That means that although heart failure can't actually be cured, there are, however, a whole range of treatments and practices such as multidisciplinary care, person-centered care planning that can make an enormous difference, whether it's for hospital admissions, whether it's to quality of life, or whether it's to reducing mortality. That's fact, that's been proven. As cardiologist Mark Dancy today said at the launch, we know what to do in a clinical sense. The problem is that we're not doing it. That's a policy challenge. That's about leadership, that's about driving change. That's what the network's all about.